In the United States, about 40% of the homes do not have a ground in the bedroom. They may have outlets that look
40%?
40%.
I had no idea it was that high.
Put it another way, most of the homes built before 1970
Do not have it.
do not have electrical grounds in the bedroom.
Okay.
They make you put it in the kitchen and the bathrooms before you can sell your home now. But there
It's
is-
code.
Yeah, that's code. But there is, if you go into the bedroom, take the wall, I mean, the outlets may have been replaced over the last 40, 50 years. But there was never any ground wire to begin with. So when they put a new outlet in, there is no ground wire to connect to.
Yeah, so if you plan on using the grounding plug in your electrical wire, you got to first make sure that it's there.
Yeah, the first thing you have to do is ensure that you have a ground system, I mean a ground there. And then if you don't, the ground rod, which is a little 12-inch rod with a 40-foot cable that we supply, that is just a temporary ground to ground you to the earth until you can have an electrical person come, put in a 4-foot ground rod, drill the hole, put in an outlet, and ground your home the way.
Is that, technically, that's all that's required is
Yeah.
putting the same rod into the ground and attaching to only one of the outlets in your house because they're all connected, so that the whole house would be grounded then?
No, you'd have to put an outlet in an older home
Yeah.
before depending on what city, of course. But there is no electrical ground in the bedrooms at all, so each bedroom would have to have its own
Oh,
ground.
so each bedroom, so each
Yeah.
room would have to do that. Okay.
Yeah.
It's a little more complex.
Yeah, there are other, sometimes you can use old telephone lines that are no longer being used because now everybody's switching to the cell phones.
Yeah.
Sometimes you can use the cable system, the shielding on the cable system. Sometimes you can use the cold water pipe. There are different ways to handle this, but it has to be somebody that kind of understands
Sure.
how to verify and
So
validate
if you
a
want to
circuit.
get the benefits of the grounding and the earthing that we were talking about with the source of free electrons to really help optimize your health, then and you want to use your ground, you got to make sure that it's truly grounded. And these devices are only a few dollars, under $5
Yes.
to check that.
Right, and the benefit is if you're not grounded and you use the pad, you're not grounded,
Yeah.
so there's no harm.
Mm-hmm.
But if you, that's
You're not going to get the
you're not going to get the benefit.
Yeah, which is why go through the hassle.
Yes, right. So, but the majority of homes are grounded, and today,
Especially newer ones.
especially all the newer homes,
Yeah.
they're totally clean. But I wanted to go one step further on the stray voltage thing. Even when you are grounded in the home, if you were to go over and touch a cold water faucet, that would be completing a circuit to ground. That is the second reason why we have a resistor. We have a resistor so you can't accidentally touch something in the home and do harm. We also have a resistor that if you are grounded and you touch another ground, you also limit any potential current flow. So we have the resistor serves a double safety standard there.
Okay, so I guess that's one aspect. I think you addressed them both. One is the potential conventional interaction with electricity that could be dangerous and electrocute you, and then the other is the more subtle one.
Right.
Are we picking up these antenna effects, which you
Right.
address? So from a safety perspective, it seems like all the bases are covered. There's
Yeah.
really no dangers here. There's no side effects, and you can't get too many electrons. Your body equilibrates because to the electron potential of the Earth.
That's it.
So you're not going to get any more. You can't overdose on this.
No.
It's like impossible.
No. And a lot of people are still concerned about the EMF. The EMF, they have to understand what they are. They're electromagnetic frequencies. They're frequencies. And so if people could put on a pair of glasses and see all the frequencies in our environment, the world would be black. There are thousands, tens of thousands of frequencies.
Million, maybe.
Yeah, and then we have, so it's the wattage of these frequencies. There's issues out there, but I like to find metaphors. It's like if you go on a clear day and you have a pond, you throw a pebble in it, and it creates ripples. That's a frequency. Then you take a handful of pebbles and you throw them into the pond, and you got noise all over the place. Or envision a swimming pool full of kids. There's noise. I mean, each one of those little waves are like
No problem. Yeah.
little frequencies.
So why don't we talk a little bit about the benefits now, and then really some of the most important ways that people can take advantage of this grounding benefits.
Yeah.
If you could just highlight those, and I want to talk specifically about the importance of one of really the reason that you initially discovered this, and that process, we'll touch on that, and then really make some pretty strong and basic recommendations for people to get these benefits immediately. So what would you perceive as the highlights of the benefits of grounding? What systems of the body does it support? Like basically we know the foundation is inflammation. So it's going to really, if you have any inflammatory process, I think a Nobel Prize was awarded for that in medicine, is inflammation. And there's more and more researchers who are acknowledging and recognizing the importance of inflammation into almost all disease processes, so heart disease, cancer, you name them. So we're going to get a radical decrease in those, any inflammatory, so and arthritis, obviously.
Yeah. So that's the number one thing that we see is a reduction of pain. If you have pain in your body at all, you have some level of inflammation, some level of chronic inflammation going on.
And you could certainly use an NSAID or Tylenol, but we don't recommend that. Not at Mercola.com. We don't recommend those drugs at all.
Right. So basically, number one is earthing puts the fire out. Number two, it stabilizes, we believe, the autonomic nervous system, and a couple of our studies show electrical stability of the ANS.
The autonomic nervous system.
Yeah, and what that means is the parasympathetic and the sympathetic, that dance that goes on. The sympathetic sensing everything in the environment, the parasympathetic trying to keep the body stable so that it can actually respond.
Most of the time we have too much sympathetic stressors, so this helps build up the parasympathetic system. And all these adrenal fatigue issues, which are definitely real and present, and one of the ways you can mediate is through processes like this.
Yeah, and so I can't get into specific cases or...
Yeah, I mean, there's a lot of different problems with support that we can see.
Yeah.
We'll have different information on that, but these are highly beneficial components, and certainly pretty much any chronic degenerative disease or aging, which is sort of the ultimate disease.
You see, I kind of look at it, and again, I'm an outside observer.
Yeah.
And just grounding lots of people over the years and listening and watching. And I remember one time I asked this one lady one time, I said, she had, I think, a significant health disorder. And I asked her, what happened? It was a chronic. And I said, what happened that brought this on? And that was just kind of a dumb question coming out of my mouth, making conversation. And she said, well, I was in a car accident. And then this chronic disease manifest, inflammation-related manifest. And didn't think too much about it. Then I got in the habit of asking everybody that I grounded, well, what happened in your life that brought this about? And I found that in some cases it was money, divorce, loss of a child, loss of a parent, loss.
Oh, loss.
Physical or psychological loss. Mm-hmm. And in other cases it was an accident or a physical injury, and it never seemed to heal up properly. Or from that point on, there was chronic pain, chronic stress, and then so there's psychological and physiological loops going on here. If you're psychologically stressed, it elevates cortisol and taxes the endocrine system. Mm-hmm. And sometimes if you have physiological issues, then the pain and whatever manifest into psychological issues. So these are the loops. Mm-hmm. Okay. And so what I see when people get grounded, number one, it does reduce inflammation. There's no ifs, ands, or buts about it. And 3 or 4 or 5 days later, or depending, some people it takes longer, but a lot of people are very quick. But some people, you see them a few days later, and you say, whoa, you don't even hardly recognize them. I mean, their circulation has improved, their demeanor has changed, meaning they're happier, they have less pain, they feel better.
Yeah. Well, if you take away, it's like taking the thorn out of the lion's paw. He gets a lot more amenable to interventions because, you're taking away that pain.
Exactly.
Which is a big source of the downhill cycle.
Right. And so then they can get, what I've heard so many people tell me, the number one phrase that rings constantly, I've got my life back. I feel like I've got my life back. I have an opportunity to get back in the game, And so earthing is...
Yeah, to me, it's one of the basics now. You know,
Yeah.
we have to exercise, of course. We have to eat the right foods and drink clean, pure water and breathe, you know, have a relatively free exposure to toxins. And then your body will self-heal. I mean, it's designed to heal.
Yeah.
But if you insulate it from the basics, it's going to be impaired. And one of the basics really is having access to this source of free electrons and through the earth and being grounded to it.
Yeah.
But we had talked about the safety aspects, and we seem to be fairly convinced that it is safe. But there are some side effects from doing this that I think we need to warn and caution people about.
Yeah.
And those side effects are really an artifact of being exposed to the industrial world. And if we were here 100 or 200 years, it wouldn't be. One of them is thyroid disease. There are a lot of, the majority of women have thyroid impairment. Adult women have thyroid impairment. There's just no question about it. There's a lot of reasons for it. Exposure to fluoride is one, the toxic toxins, other toxic halogens such as bromide will also do it, and lack of iodine. Goitrogens such as soy and other toxins can impair. So there's a lot of reasons why your thyroid could be messed up. But as a result, people, and one of them we believe, and your experience shows, based on this warning, is that the lack of free electrons may be even the most largely unrecognized cause of thyroid dysfunction. Because when people who are put on thyroid replacement hormones to compensate for this dysfunction and stabilize and do well, and then they're grounded, the consistent response that you see in your observations are these people have to reduce their dose because their thyroid improves. So why don't you expand on that? Is that what you're...
I mean, there's three things that we are probably going to have to make. We talk about it extensively in the book, but now that our studies are finishing up and we have so many people out there grounded now and the reports that are coming in and so on, there are three things that show up consistently. One of them, I mean, the first is thyroid. I had no idea the amount of people taking thyroid meds. But what happens with thyroid, I mean, it's systemically connected to everything in your body. But anyhow, within the first few days of grounding, we had a few people start calling up and saying, well, you know, do you think earthing could have anything to do with the thyroid, because I'm starting to get heart palpitations. Now that is a common effect of overdosing on thyroid meds.
Too much thyroid hormone.
Yeah. So anyhow, shortly after that, we started hearing a lot of it, so we started telling people, okay, go to your doc and measure have your measurements taken, and then they started reducing the thyroids, and some of them very, very quickly. And normally, thyroid doesn't, I mean, it takes months to get off of it.
Weeks, for sure.
Weeks, for sure, yes. But some of them started coming off of it very quickly, very rapidly. Now, we don't understand all of that yet, but again, that's part of the endocrine system. And based on the SoCal study that was recently published, I mean, earthing affects...
All right, so if you're on thyroid, and you want, many people viewing this likely are, is be really careful and monitor your dose, and maybe even proactively or preemptively lower it.
Well, just at least pay attention.
Yeah, you got to know that's a potential concern.
Yeah. Because we saw two different things. We have some people that sleep more than others. They spend more time. Other people are on such a high schedule, they don't get enough sleep, and so you have to be very careful about your thyroid.